Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The purpose of this tape is to discuss the various aspects of bonding brackets using two different types of adhesive. Today we have with us Mr. Paul Gange from Reliance Orthodontics, who will be acting as our expert with regard to bonding procedures. We're going to be shooting this in my practice, and we're going to be using a real-life patient again for this procedure. Paul, do you want to comment about some of the most common mistakes that people make in this type of bonding procedure?
Okay, thank you. The two systems we're going to use today, one of them is going to be a no-mix system and the other a mix system. And the most common problems actually occur before the bonding material is even applied to the bracket, and that occurs in the tooth preparation. In the prophy, if that's not done properly, or the acid etching and the amount of time of the acid is allowed to remain on, the rinse time, maintaining a dry field, all these points are critical to produce an enamel surface that is clean and dry and therefore will accept the composite and give you a good strong bond.
I think we first would like to deal with the question of whether or not the brackets, as they are provided by the manufacturer, actually do contour the teeth. And we have already checked these brackets, the brackets as you can see here, so that we know that they do fit the contour of the patient's teeth.
This is critical, especially if you're going to use a no-mix adhesive. Of course, the principle of a one-step or a no-mix adhesive is that the catalyst for the paste is in the liquid primer. That liquid primer is applied to the back of the bracket, the base of the bracket, and of course to the tooth surface itself, and then the paste is applied to the bracket. When the bracket is applied to the tooth, onto the tooth, the primer sandwiches the paste between the two layers, and that's what starts your polymerization. Therefore, if your bracket base is not perfectly flush all the way across the base on the tooth surface, your bond strength will be considerably weakened. And this is most prevalent in bicuspids and also in molars.
Okay. Now we're going to ask one of my dental hygienists to assist us in this procedure, just like she normally would do in the practice. The first step is, of course, the preparation of the teeth with pumice. Paul, you want to comment on the importance of this and what the particular procedures are?
The prophy is a critical step. It's kind of the initial cleansing before the acid etching, which is more of a deep cleansing. Prophy should always be done with a rotary instrument, utilizing a rubber cup or a brush. If there's a pellicle present, a brush would remove that. In this instance, the patient's hygiene is good. There is no pellicle present. Therefore, a rubber cup is satisfactory. The material used, in this case, is a regular just flour of pumice. However, you could use a prophy paste that did contain fluoride or one that was even flavored. One thing that you want to prevent is using a prophy paste that does contain oil, of course, and the reason for that is that if there is oil in the prophy paste, that will leave a film on the enamel, and the acid will not penetrate that film.
Okay. Is there any difficulty if a patient has a fluoride treatment immediately before the bonding procedure?
No, there had been the misconception previously that if a fluoride treatment had been given, that it would inhibit the etch process. However, it's been shown that the fluoride used in fluoride treatments or even in prophy paste is totally soluble in phosphoric acid. So if a fluoride treatment is given, it really has no merit at all, and yet it will not inhibit the etch at all either.
Is there any advantage of using brush versus the cup?
The brush would be used in that area where you felt that there may be a pellicle still present on the enamel surface.
What's a pellicle?
Pellicle is that clear coating that covers the enamel on a freshly erupted tooth. You'll find it most prevalent in bicuspids and some freshly erupted or newly erupted molars, posterior teeth. The brush in some cases will remove it, and even in other cases it won't remove it. In that instance, scaling is what's required. But as long as the Prophy is done with a rotary instrument, either a rubber cup or a brush, should be more than adequate to get the job done.
Okay. Now Liz is going in the contacts to make sure that the contacts are clean and that there's no pumice left in between the teeth. Liz is now going to place the cheek retractors in the dry angles, which will be used to prevent the flow of saliva from the opening of the parotid gland.
And open.
Isolation and maintaining a dry field is critical from the time that you start etching all the way through the bonding procedure to ensure that you have a good, clean area to bond to. Therefore, proper isolation using cheek retractors and dry angles, I feel, is critical regardless of the bonding procedure.
Now, Amy, is that pinching anywhere?
Mm-mm.
Can you bite down a little bit more?
There we go.
And then open wide.
I want to show that.
And
We're also using a tongue away, which is a product that can be used in the posterior aspect of the mouth to quite literally keep the tongue away.
Mm-hmm.
and then bite firmly. And you want to keep it right there.
You want to talk about the etch and the various chemicals that you use for that?
The etching material that's being used currently is a 37% concentration of phosphoric acid. It's available in two forms, either a liquid or a gel. And it does not matter which form you use, the effectiveness of the etch is the same. The etch should be applied in a dabbing motion, never rubbed or swiped onto the enamel, because once the acid touches the enamel, you've exposed the enamel tags, and these are very delicate and can be knocked off. It's dabbed onto each tooth and allowed to remain on permanent teeth for 60 seconds. For deciduous teeth, it would be 120 seconds. And the only difference really between a liquid etch and a gel etch, of course, is the body of the material. The gel etch would have no run whatsoever into the gingiva. A liquid etch has to be controlled a little bit more.
Now, is it sufficient just to place the etch on the teeth, or do you want to continually add material?
After about 30 seconds, it's recommended to go back and re-dab each tooth with fresh acid to make sure that the acid has penetrated the enamel properly. This is especially critical with a gel etch, which has a tendency to sit on the very, very surface of a tooth.
Okay.
In this instance, we're not acid etching the one lateral because the lateral has a composite restoration on that, and we're going to treat that a little bit differently than we would.
Now spend 60 seconds.
At this point in time, the acid must be rinsed thoroughly, and you'll notice Liz is squirting all the teeth quickly with a stream of water, combination water and air spray. This stops the etching process.
All right, Liz has just finished the rinse process. And Paul, you want to discuss that as far as the importance of that and what the criteria are for proper irrigation?
After the acid has remained on the enamel for 60 seconds and not to exceed 90 seconds, because if it goes past 90 seconds on permanent teeth, it has the effect of wearing down the enamel tags. The acid should be rinsed off the enamel with a combination water-air spray. And the manner in which Liz did this was she ran the water-air spray across the arch back and forth once or twice, and that stopped the etching process. Then she went back with a concentrated effort on each tooth for 10 seconds because she used a liquid etch. Now, this thorough rinsing is critical for two reasons. One, it removes the demineralized particles that we've loosened with the phosphoric acid. And second of all, it removes the calcium phosphate salts that were created from the phosphoric acid.
Mm-hmm.
And it's critical to have this thorough rinsing to get these particles off the enamel surface to give us a clean area to bond to.
Now she has just used water, and now she's going to be using air to wipe off or to blow off the teeth.
Right.
Now, Liz, do you want to demonstrate how you check to make sure that there's no water in the syringe?
When you blow your syringe, the air from the syringe onto the bib, if there's any water or oil contamination, it will show on the bib. Occasionally, when you first turn on your air line, there will be a little bit of water. So you run it until you are sure that you just have air. And then carefully, so as not to blow saliva back on the etched teeth, you blow from the binding surface back up toward the gingival margin with air to check your etched surface.
Also at this time, what Liz will be looking for are two things. The enamel should appear dead white and chalky. If it appears chalky in some areas and shiny in others, that's the instance of having a pellicle still on the enamel. In that case, that tooth should be scaled and then re-etched. If the tooth has a yellowish appearance to it, that means there's tartar still on that enamel surface, and that must be also scaled and then re-etched from there. From this point forward, isolation is critical. If saliva was to contact that enamel surface at this point, saliva, of course, contains protein and will remineralize that tooth. That tooth must be re-etched for 15 seconds at this point, and then rinsed and dried, and then proceed with the bonding procedure.
After the teeth have been dried, it's important, if you have any teeth that have a composite restoration, to apply a small amount of plastic bracket primer. And this is done usually starting from the gingival surface and working toward the incisal surface. In Amy's case, she has a lateral incisor that does have a composite restoration, and so therefore this type of conditioner must be used. Now for this demonstration, we are going to use a one-step adhesive on the upper left, central, lateral, and canine. And so I'm now going to apply the necessary catalyst, which is like a sealer, to these teeth. Paul, do you want to discuss the nature of the material I'm placing on the teeth?
The catalyst is in the Reliance primer. That's the liquid that is being applied to the enamel surface, and it should be applied in a very, very thin layer. This same primer will also be applied to the bracket base in a thin layer. And then, of course, the bonding paste would then be applied to the bracket, and the bracket applied to the tooth. And then it's the sandwiching of that layer of paste between the two layers of primer that gives us the polymerization.
Now in the placement of the brackets, we find that, or at least I have found, that the most convenient and efficient way of having this procedure carried out is that if I will go ahead and have in my hand, on the upper arch anyway, a mirror and what is in fact a gold foil knife, which is perfectly adapted to the placement of a bracket on a tooth. Now Liz will then place the one-step adhesive on the bracket and then place the bracket approximately in the position on the tooth. The Reliance comes in preloaded tips, and so they can be placed in the syringe for easy application to the bracket. Usually the application of the adhesive is carried out by the chairside person. Liz is now placing the adhesive in a thin layer on the bracket, and then she will place the bracket on the tooth. I now have about 30 seconds to position the bracket. This again is done with the gold foil knife. Then I check the position, and then I press it to place. Now at this point, go around the bracket to make sure that there is no flash, and then check the position again to make sure it's correct. The next bracket is the lateral incisor, and in this case we have already conditioned the composite restoration. I once again position the bracket, check the position in the mirror, and then press it to place. Now, in the preparation of this case, the canine bracket did not quite fit the contour of the canine, and so we made adjustments in the contour prior to the time that this procedure was started. Again, checking in the mirror. And positioning the bracket. The right side of the dental arch will be bonded with phase 2, which is a mixed system. Paul, what's the difference between Reliabond, which we're using on the left side, and the phase 2?
Phase 2 is a mixed system where your first step after etching would be the mixing of an A and B sealant, a liquid sealant, and that would be painted on the enamel surface in a thin layer. And then an A and B bonding paste would be mixed and applied to the bracket. The mix system produces a little bit more bond strength than the no-mix system. And second of all, it is not as critical as to how well the bracket base conforms to the labial tooth surface with a mix system.
Because the sealant is a liquid, you mix parts A and B together quickly in just a few seconds.
Then the sealant is applied to the labial surface of the teeth, again starting in the gingival area, making sure that you do not contact the gingiva. Okay, and then there should be a uniform, shiny appearance to the teeth. Now the two parts of the phase 2 are being mixed together, and then a small amount will be placed on the bracket. There's an individual mix made for each bracket that is being placed. The bracket is then placed on the tooth as before. It's positioned. The position checked with a mirror, then is pushed firmly in place, and then any flash is removed along the outside. Now, one of the things that is different about using a mixed product such as phase 2 in contrast to Reliabond is the fact that there is no primer placed on the bracket itself. It is strictly the A and B paste which acts as the catalyst and the base. We are now going to place the bracket on the lateral incisor. Again, the bracket is positioned appropriately, position checked in the mirror. Then the bracket is pushed into place, and there's very little, if any, drifting of the bracket after it's positioned. And then we carefully clean off the excess. You turn your head to the left a little bit, thank you. Paul, what would happen if, let's say at this time, some saliva would contact the canine?
Even though that canine has been sealed, if saliva contacts it, which it contains protein, that would interfere with the bond strength. Therefore, I would suggest you go back and reprophy that tooth, re-etch it for 15 seconds, and then reseal it.
Okay. Now we're placing the canine bracket, pushing it in place after we have checked the position, and then we finally position it like so. And once again, final check. It's important to check to make sure that there are no obvious gaps that are being left, and if this were to be the case, those would have to be either filled in later or the bracket be repositioned.
I think it's critical to note here at this point also that the working time, once the pastes are mixed, is 2 minutes. And during that 2-minute working time is when the excess adhesive flash also should be cleaned off. Because once that hardens, unlike the no mix, it really cannot be removed unless it's removed with a disc or a burr.
Now we've just completed bonding, let's say 6 brackets. How long do we have to wait until the arch wire can be placed in the mouth?
The rule of thumb is that you can determine if you have some excess adhesive on the mixing pad. Once that has hardened on the mixing pad, you can take the isolation out and then wait 5 full minutes after you've placed the final bracket, and then you can tie an active arch wire in.
Okay. Now, Paul, one thing we didn't cover today was the occurrence of a porcelain jacket. What special procedures should be taken when you have a patient who has a porcelain jacket?
The first thing you would look at is if the jacket is less than 2 years old. If it is, then it still has a glaze on it, and that glaze must be removed with a greenstone.
Mm-hmm.
Then your next step would be to profee the porcelain, rinse it thoroughly, acid etch it for 30 seconds. Rinse the acid off, blow it dry.
You mean the same kind of acid as you do for the
Regular phosphoric acid,
okay.
Exactly. Rinse it, blow it dry, and then take the porcelain primer, paint 1 coat of it on the jacket, leave it untouched. Don't blow it dry or rinse it. Then wait 1 minute and then apply a 2nd coat of the porcelain primer. Wait 2 minutes and then proceed with your bonding. If you're using a no-mix, you would still paint your Reliabond or no-mix primer on the porcelain jacket. And if you're using phase 2, you would still mix your A and B sealant and paint that in a very thin coat on the porcelain jacket.
Okay. Well, I think we have certainly gone through the steps, and I hope that this has been helpful to those people that might be viewing it to make sure that these procedures are carried out properly. I know from my own personal experience that the procedures that we did today work, and that usually when there is a failure, it's not a product failure, but it's usually a pilot error in the sense of contamination or something like that. Okay.
Once again, we can't emphasize enough how important the tooth preparation steps are to successful bonding.
Right. Thank you.
Thank you.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.